Measles, once thought to be eradicated, is slowly making a comeback across the United States. With over 300 reported cases, including a recent one in Colorado, many people are asking, am I protected? Most of us remember getting the MMR measles, mumps, and rubella vaccine as children. But what about adults? Do you need a booster shot? Today, I'll explain who should consider a measles booster, why natural immunity isn't the best option, and what's true about some of the claims circulating on social media. Let's dive in. Do Americans need a measles booster? For most healthy Americans, if you've received 2 doses of the MMR vaccine, you're in good shape. You're 97% protected from measles. However, there are certain groups of people who may need a booster shot. Here's who should consider getting one. People born between 1957 and 1968. If you were vaccinated during this window, the vaccine used at the time was less effective. A booster is recommended for this group. People working with high-risk individuals. If your job involves working with vulnerable populations, such as pregnant women, cancer patients, or anyone with an immunocompromised system, you're at higher risk of exposure and should consider a booster. Travelers, if you're traveling to regions where measles is endemic, a booster shot is highly recommended to prevent potential exposure. So what if you're an adult unsure if you were vaccinated? Let's talk about how to find out. How can you know if you're protected? If you're unsure whether you've been vaccinated, especially if you were born before the 1980s, the best way to find out is through a blood test. This test checks for antibodies against the measles virus. If your antibody levels are high enough, you're protected. If not, your doctor may recommend a booster shot to give you that extra protection. Now, let's address a common misconception. Is it safer to get natural immunity by contracting measles? Absolutely not. While some people might argue that natural immunity from contracting measles is better, this is incredibly risky. Here's why. Severe complications. About 20% of those who contract measles end up in the hospital. Potential complications include pneumonia, brain swelling, permanent hearing loss, and even death. Long-term effects. The damage doesn't stop once the infection clears up. Many who survive measles face long-term complications, which can significantly affect their quality of life. It's preventable. The measles vaccine is highly effective at preventing the disease, and with 97% protection from 2 doses, it's the safest route. So, while natural immunity sounds tempting to some, contracting measles is not worth the risk. This leads us to another question many people are asking these days. What about the vitamin A trend on social media? Recently, there's been a lot of buzz about using vitamin A as a treatment to prevent measles. While it's true that vitamin A can be beneficial for kids in developing countries who are malnourished and have severe measles, it's not a preventive measure in the US. There is no evidence that vitamin can prevent measles. The only proven prevention is the MMR vaccine. For those who are already sick with measles, vitamin A may help with recovery, but it's not a substitute for vaccination. Don't fall for unproven remedies on social media. Stick to the facts and get vaccinated. Are there any risks to getting a measles booster shot? If you're in the group that needs a booster, there's no harm in getting it. However, it's important not to get a booster if you don't need it. The MMR vaccine contains a live, weakened virus, and if you're already protected, getting the booster could cause unnecessary complications, including inflammation and ear problems, as seen in some cases. Always check with your doctor before getting the vaccine. If your antibody levels are sufficient, there's no need to get another shot. Conclusion: measles is a serious, preventable disease, and with cases on the rise, it's essential to know your protection status. For most healthy Americans, the 2 doses of the MMR vaccine offer excellent protection, but certain groups may need a booster. Natural immunity is not the answer, and unverified remedies like vitamin A will not protect you from measles. Vaccination is the safest and most effective way to protect yourself and those around you from this dangerous disease. If you're unsure about your immunity status, talk to your healthcare provider. And consider getting a blood test to check your antibodies. Stay safe, stay informed, and make sure you and your loved ones are properly protected.